Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Lancet medical journal shows strong evidence that COVID-19 spreads through the air. Is there an urgent need to change current health protocols? Also, experts say COVID-19 vaccines remain safe despite links to some blood clot reports. DOH's vaccine expert panel member and head of the adult infectious diseases at San Lazaro Hospital Dr. Rontgene Solante joins us live. And later, the Bayanihan spirit is alive and well as more community pantries sprout nationwide, drawing inspiration from the Maginhawa Community Pantry concept. Ana Patricia Non tells us more about this initiative live. Six experts from the United States, the UK, and Canada publish a study in the Lancet journal saying SARS-CoV-2, the virus that causes COVID-19, can be transmitted through the air. The recent study is a major shift from the predominant scientific view that the coronavirus spreads primarily through smaller aerosols or droplets. How would this study impact our current COVID-19 response, and how quickly should the government change its policies? Let's go straight to the source of the story. We have the head of the infectious diseases at San Lazaro Hospital and the government's vaccine expert panel, Dr. Rontgene Solante. Dr. Solante, good to have you again on the source. Thank you for your time.
Hi, good morning, Pinky.
So there was a report that the COVID-19 virus could be airborne. Of course, that was according to some health experts in the United States, UK, and Canada. But I know that in an earlier interview, you were asked about this, and you said that the main mode of transmission is through droplets. Just so we understand this better, Dr. Solante, in very simple terms, siguro, how can one be infected through droplets? What is the process?
Okay, when you say droplet, when a particular COVID positive will cough or sneeze, so meaning the droplet will come out from that particular area, and then anybody who is within 3 feet can get that without wearing the face mask or the face shield. With airborne, you have a longer trajectory and longer for these particles because they're smaller, so they will be in the air longer compared to a droplet. And that makes it that you need to more physical distance, like 6 feet to 8 feet. And at the same time, if you are in an enclosed space without ventilation, then you need a very good filtration capacity face mask, like an N95 mask.
Dr. Solante, let's just ihiwalay muna natin si droplets versus airborne para po maintindihan natin. And for those watching us to really understand. Sabi mo ang droplet, kapag may umubo o somebody coughs or sneezes with COVID-19, you can be infected by this. Ano po? So how does it happen? Kailangan ho ba, does it get suspended in the air pag nag-sneeze siya o umubo siya, o kailangan ba mahulog sa isang surface in an object, on an object, and kailangan mo ba hawakan yung surface na yon at hawakan ang mukha mo? Doon muna po tayo.
Okay, so sa droplet, when you cough out, so you get the droplet will either you inhaled it within 3 feet, or the droplet goes down, and then sa surface, when you touch the surface and you touch your mucosal area like your face, your nose, or eyes, then chances are you still get the virus because of the particles that's inside that droplet.
So, Dr. Solante, I hope you don't mind. No? So, pag meron pong umubo o somebody sneezes or somebody coughs, with you are within 3 feet, for example, ano po, pwede mo pong malanghap yun. Yun ho ba ibig sabihin nun?
Yes,
okay.
Yes, correct.
So, huminga ka, pero COVID-19 positive yung nasa harap mo within 3 feet. The chances of you getting infected is almost 100%.
Yes, without the face mask, without the shield.
Okay. The other mode is, Dr. Solante, sabi nyo, pag nahulog po yung droplet sabihin na po natin sa isang mesa, Tapos
Yes.
nahawakan nyo yung mesa, tapos hinawakan mo yung mata mo o ilong mo o bibig mo, papasok po yung virus doon sa either doon sa tatlo.
Yes, correct. Doon sa mucosal surfaces ng katawan natin, sa face.
Okay. So, here's another question. Sabihin po natin nahulog sa surface, ano po? Pero hindi nyo naman hinawakan yung inyong muka. Okay? Are you safe?
Yeah, as long as you don't touch anything that is in your face.
Pero pwede nyo malanghap.
Yes.
Okay. So, here's one question that was brought about why some experts are saying possibly airborne tayo, but I still want to talk about these droplets. No, why does that happen then in a hospital, for example, in a hospital setting, that we have the medical frontliners, the doctors and nurses, fully geared, N95, PPE, and yet they get infected? Possibly dito po muna tayo sa droplets.
There's the chance there is really very low because you are protected. You have the gloves, you have the face mask, and you have also the face shield. So 99% you are protected against the droplet.
All right, kasi ano kayo, fully covered, ano? You're fully protected.
Yes.
Okay, now let's go to airborne. Meron po kasi ako nakausap na doktor, ang sabi niya, kung totoo tong airborne na to, medyo this is very alarming. So let's go back to your description naman. Ano naman ho pagka airborne?
When you say airborne, so you have a smaller particle compared to the droplet. So we call that aerosolized droplet. So meaning it can stay in the air longer compared to the droplet, and it can be longer also than the 3 feet, like 6 feet or even 8 feet. No, there are studies that has been done, especially in an enclosed space without ventilation, because they stay in the air without ventilation because of their ability to be airborne. So the danger there is that it's longer in the air, so you have a higher risk of getting it. And if you're not wearing also a face mask that can filter a very small particle compared to a droplet, then the higher chance that it can still penetrate to your mucous membrane or even to your eyes.
Then it's the same process. Malalanghap po ito.
Yes. Yes.
So one of the difference that I'm understanding right now, droplets are bigger and airborne there's much smaller particles. That's
yes,
one.
That's precisely correct.
At yung pangalawa po, si droplet, 3 feet, pwede kang mahawa. Ito ngayon si airborne, kahit na 6 feet ang layo mo, pwede ka pa rin mahawa.
Yes.
How alarming is this, Dr. Solante?
This is alarming. I would say this can be alarming, especially in public places, because in the hospital, we already, our way of treating COVID-19 is already based both on airborne and droplet. But if you are in public places and in an enclosed space, you're only wearing a face mask and you're not practicing the 6 feet or more distance, then that's the danger there with airborne transmission.
So let's talk about offices, for example, enclosed offices na may aircon po, no? So what is your suggestion now? Dapat ho ba, because of this recent study, which, well, I wanted to ask you, do you agree with this recent study?
Yeah, I totally agree with that, because that's an evidence. They did the study on this, no, and that's the reason why that we need with the progress of this pandemic, we see a lot of new findings, and we must also observe and follow or some tweak the guidelines on how to protect ourselves.
So let's give practical situations, realistic ones. You're in an office, enclosed po siya. Kailangan ho ba magpalit na yung protocol? Kasi dati dapat, di ba, 3 feet lang ang layo nyo. Are you saying now it is more recommended that definitely at least 6 feet na ang layo na ng bawat individual to each other?
Yes. And then I think the most important part there, Pinky, is when you are in an enclosed space, you have to maintain a good ventilation. That's the number one, no? Maintain a good ventilation. Second is that you maintain a very longer space between each person, the physical distance. Third is that if you can avoid talking and a lot of this conversation, then you have less of these aerosolized particles in the air.
Wow. So is it time to suggest to government to start adjusting the social distancing that we've gotten used to?
Yeah, I think it's already in the guideline. It's just a matter of reinforcing it again, and at the same time, strictly implementing the adequate and proper ventilation in an enclosed space. Because the danger of airborne is not much with an open air or free space. It's really in an enclosed space, and you have more people inside. You cannot practice the physical distance, and a lot of people will be talking. So talking is the stimulus for you to aerosolize. And then you have that short distance, not practicing physical distance. Then you have airborne particles in that room because of the poor ventilation. Then these are all the factors that can increase the risk of transmission.
How long does how long does a droplet stay in the air or an inanimate object? And how long does it stay in the air when it's airborne?
There are studies that it can stay there around 1.5 hour up to 3 hours in the air.
Which one? The droplet or the airborne?
The airborne. The airborne.
Okay, sorry, Doc, how long again? 1.5 to 3 hours?
1.5 hour, 1.5 to 3 hours. It can stay airborne in an enclosed space.
So those are the just suggestions you made, no? Stay 6 feet apart, proper ventilation. Let's talk about proper ventilation. Ano ho ba sa Tagalog ang proper ventilation? Kailangan ho ba bukas sa mga bintana? Kailangan ho ba merong machine? Parang yung ginagamit po sa hospital that, what is it? A negative somethings, Dr. Solante?
Yeah. So ang pinaka-simplest diyan is that you open the air, you open the window so that air coming outside will go inside, so that air inside will also go out. And that in itself will lessen the gravity of the airborne particles inside that room. So that means it will lessen the density of the airborne in that particular room. That's the most important. Now, in offices that you cannot maintain an open window because of reason for one or the other, that it is a high area or high building, then you need to consult with your engineer on how to create a negative pressure inside that particular room.
Yun po yung ginagamit nyo sa ospital, ano po yung negative pressure?
Yeah, we are using a negative pressure, and here in San Lazaro, in most of our wards, we have very high ceiling, and at the same time, we have open windows, so which is more than enough to decrease the density of airborne particles.
So you actually combine both. You open the windows and you have that negative. What do you call it again, sir? Negative.
No,
yeah,
negative pressure room. So we only have very limited negative pressure rooms, and in fact, most hospitals only have limited numbers of negative pressure rooms. So in most hospitals, we just open the window, okay, and then so that there will be good ventilation, adequate ventilation in the room.
We need to take a very short break. Dr. Solante, the source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, Dr. Rontgene Solante. We're still talking about droplets versus airborne dahil may bagong ang pag-aaral in the Lancet journal that says that the COVID-19 virus could be airborne. I wanted to ask you, Doc, itong negative pressure, is that a machine that you use in hospitals, or is it a room that has negative pressure?
Yeah, there's a machine that is installed in that room that will suck out the air and then cause a negative pressure in that air, so that any airborne in that particular room will be sucked out to the outside environment.
I see. Okay. What happens though in, let's say, people commuting? Let's give an example. What about MRT? Would you say there is proper ventilation there? I'm not sure if you can answer it, but is that safe? Knowing that sinasabing airborne?
Yeah, so for LRT, I think they should modify now that they have to have an adequate and proper ventilation. That's one, and then they have to limit the number of people in that particular area, and at the same time they should not be they should not be allowed. The passengers are not allowed to talk, to use the cell phone, so that there will be no aerosolization of the possible COVID-19 patients' cough or particles.
Would you say it's even safer to take buses that are non-air conditioned, or definitely yung mga jeep na hindi naman po air conditioned?
Yeah, I would highly recommend the open air, and then again wearing the face mask, face shield, and obviously no talking, no eating, and no using your cell phone.
Yung iba nga nag-aano na po double mask tapos face shield.
Yeah, that's okay lang, no? Pero actually sa atin naman dito ngayon, meron na tayong face shield at saka face mask. I think that would be enough, no? As long as there is an open ventilation in that particular transportation system. Usually ang ano lang naman yan is like 30 minutes for less than 30 minutes ang travel. Dapat ma-maintain natin yun na hindi matagal. Ang importante dito yung interaction, that if you are in that particular area or confined, wala talagang ano yan, walang magsasalita, walang sasagot ng cellphone, walang kakain.
What about elevators?
Yeah, so again, elevators is a very high risk, no? Because that's really close and walang magandang ventilation sa elevator. So there should be protocol guidelines on people who will be using it, like few people going inside instead of the usual number, like limited to 2 to 3. And then again, wearing the face mask, face shield, and then no talking and no using cell phone.
I hope you don't mind my asking this, but for those who are very paranoid to go inside elevators, because some live in high-rise buildings, in offices, etc., what else can we do? Is there anything that can be placed in elevators to be able to make it safer, aside from what you've already mentioned, na limited, no talking when inside the elevator?
The problem with elevator is you have an air conditioning system inside, no? And I don't know if they can put a machine there that can also suck out the airborne particles, the possible airborne particles. I am not an expert in engineering control, but I think the principle there is that maski hindi mo i-modify yan, Pinky, basta walang magsasalita lang, because that's the main reason why you will be aerosolizing this virus outside of your outside of the body and putting it in the environment.
Thank you for all those tips and making us understand how one can really be infected. Sometimes we really have to keep reminding ourselves, no, Dr. Solante, on how one can actually be infected and how this virus has been evolving. Very quickly, I want to talk about the vaccine efficacy. So any update on AstraZeneca, at least in the studies abroad? Because dito, di ba, hindi po pwede for 60 and below.
Yeah, I think there are recommendations from European, the EMA, the UK. They have new findings now that like in the Oxford news the other day, that getting the thrombosis, having the thrombosis is still higher among those who had COVID compared to getting the vaccines. So meaning you have higher risk of getting the cerebral venous thrombosis compared to getting the vaccine. So the potential benefit is still higher and outweigh that of the rare side effect of the vaccine.
And how are we supposed to understand and confront the issue that, according to the DOH, very recently there was an additional over 600 new cases of the combined na po, the UK, the South Africa, and the P3 variant?
Yeah, this 600 cases is really too small compared to those who were given the vaccine, like in millions already. And if you again weigh the risk of this 600 getting the 600 getting this thrombosis or blood clots compared to those who did not get it and were protected against COVID, protected against getting the severe COVID and preventing death, then again, for me, it's still the benefit outweighs this small risk.
Risks. Okay. Just one last question. Is there a vaccine, Dr. Solante, that can protect us against the UK, the South Africa, or the P3 variant?
Okay. Currently, as of now, all of these vaccines are still effective against any of this variant. No? It is just that based on some of these laboratory tests, there is decrease in this ability of this antibody produced by the vaccine to fully neutralize the virus. But it's not zero. It's still high and it's still effective. So the message here is that we don't worry yet, especially in the Philippines. We don't worry yet about this variant. No? What is very important now, we have to focus on vaccinating the population that we want to receive the vaccine to get the benefit, potential benefit of not getting the COVID and not getting the severe COVID.
Dr. Rontgene Solante, it's a pleasure speaking to you. Please take care, sir.
Thank you, Pinky, and good morning.
And coming up, the Bayanihan spirit lives on as more community pantries sprout nationwide. We'll speak to Ana Patricia Non, the creator of the Maginhawa Community Pantry, after the break.